When a patient comes in to see you with back pain, I'm just curious if what's more common? Is lower back pain, or is it their pain all over the back?
Typically, in terms of frequency or prevalence within just everybody in the population, at some point in time in one's life, there's an 80% chance of getting low back pain. Okay, so 80% of the population will have some sort of back pain at least once in their lives. And I say at least once in their lives. So that is a big part of our practice, is low back pain. But less commonly we see other things, but we are quite skillful in other parts of the body, upper back, neck, headaches. Chiropractors are musculoskeletal experts, meaning muscles and bones and joints. Okay, so anywhere from head to toe, really, neck pain, shoulder problems, so people with tendinitis in the shoulder, frozen shoulder, all sorts of sport type of problems, or just old age even problems like arthritis, elbows, wrists, knees, hips, lower leg, ankle, foot problems, so a whole gamut of stuff that deals with the muscles and the bones and the joints. Okay.
What can they, and especially kind of focusing on the back and shoulders and neck and the whole spine, what can they expect when they come in to see you? What do you do for them?
Okay, for anyone coming into my own practice, initially when a patient comes in with whatever problem that they may have, I take a thorough history. So asking a lot of questions about the problem that you have. You know, so where is it? How often do you get it? But also investigating things like your lifestyle. So what is your work? You know, describe your work day, because maybe something at work is causing the problem or making it worse. Or when you go home after work, maybe you have a whole bunch of chores to do around the house. So never rest. So we need to find out those things to help you recover, help that patient recover. Because it's finding out what the problem is actually quite simple. What's I find important is finding out why it happened. And if you know why it happened, then maybe we can prevent it in the future. Okay. And also a big part of my practice is also instructing patients on how to self-care. You know, so that would be exercises, lifestyle modifications, so proper exercises to recover quicker, and also to prevent future reoccurrences.
I love that answer, because I think of you as a chiropractor and the manipulations you'll do on them, which we can talk about after.
Sure.
But to you, it's even more important to make sure that you are helping them do things at home so that they can fix the problem on their own.
Correct. Yeah. So after taking a thorough history, asking the questions, we then do a physical examination. Okay. So again, poking here, it's checking out the muscles, seeing what your strength is here. There may be muscle imbalances that may be the issue. So again, that helps me in telling you what to do in terms of, oh, you need to strengthen this up on this side a lot more.
And then you'll help them figure out how to strengthen it.
Correct.
Yeah.
Correct. And there are general exercises that are good for everybody, but each individual person is different. Okay. So it's good to have a very individualized, specialized program set for you. And from that, from our end, at least my end on treatments, there's a variety of things that we can do. There's lots of things what we call modalities, machinery that we use, things like electrical muscle stimulation, laser therapy, ultrasound therapy, stretching, just where I help you stretch. And also doing what chiropractors are famous for, is doing some adjustments, and that's really what the adjustments do is take pressure off certain areas that may be compressed, like the joints or the nerves. Okay.
So the first assessment will be a longer appointment where you go through the history and maybe do some adjusting and education.
Yeah, typically it is a longer visit.
And then what about after that? I'm sure it depends on what people are experiencing, but they can expect to come back to you regularly while you...
Generally speaking, one treatment won't cure anything. It does require a series of visits. The general rule is the longer you've had it, the longer it takes to get better. Similar to exercise, it's not one day of exercise that everything's fine. Treatments, one visit typically won't cure anything. Okay, it does require a series of visits. Depends, lots of different factors are dependent on it. your age, okay, for one, is a huge factor. People who are 20 get better quicker, heal quicker than someone who is 65. You know, that's fairly obvious. But also other factors include, well, your job is a car mechanic, let's say, okay, so you're constantly looking up on a hoist, your arms and shoulders up there, so your neck, if maybe always stressed, physically stressed. So with treatment, it could be a case of with the treatment and there are exercises that are doing 2 steps forward, go back to work, could be 1 step back. You know, so how long it takes is variable depending on those types of things.
But is the goal to see them a little more frequently at first, and then gradually as you make improvements, they'll be seeing you less in the long run?
Typically so, yeah. That typically is so. So again, trying to teach strategies to cope and manage on their own. Okay, so the goal is not to constantly see me all the time. But if the patient doesn't do the work on their own, then they will. I think there was an old commercial, I think it was a Fram oil commercial where they said, you can pay me now or you can pay me later, type of thing. So similar type, if you don't do your work in terms of lifestyle modifications and exercises, then yeah, it will take a lot longer.
But if someone does come into you with some kind of pain, and we're kind of talking about back pain here, you often feel pretty confident that over time you can have quite an impactful...
Oh, absolutely.
Yeah.
Absolutely. Seen it a lot over my over 20 years of practice. And see it as well as a clinical instructor at the Chiropractic College. I supervise student interns at the student clinic, overseeing and teaching them to educate their patients, but also helping them learn the skills to actually treat the patients as well.
Okay,
so
that's great.
Yeah.